Hi, welcome to my first YouTube video. This is Psychology Noir with Dr. Lund, and I am Dr. Lund. A little bit about me. I have 40 plus years in the field of psychiatry. I'm a psychiatric nurse practitioner, have a doctorate degree in family and child sciences, have done a lot of work with diagnosing and treating a multitude of patients with different diagnoses, from personality disorders, mood disorders, thought disorders, and yes, I'm a baby boomer. I know my clinical stuff, but I'm not all that sharp on some of the technology. So folks, bear with me on this. I'm doing my best. We'll see what happens. What I'd like to do is, again, explain Psychology Noir. I've always had an interest in things a little bit off topic, a little bit that have shades of gray, even the darker side of psychiatry and psychology. Right now, we are living through a very interesting noir in itself, is the current trial that is totally capturing the country. And so I'd like to talk today, as many folks on YouTube and clinicians have done, about the diagnosis of personality disorder, borderline personality disorder. These folks have a very soft spot in my heart. I have treated many folks with this diagnosis. And if I could ask you to remember, as we go on and as you learn more about the diagnoses, is to me that this diagnosis was born out of trauma. Folks who had endured some pretty horrific things in their childhood, which resulted in problems with reasonably dealing with emotion. As many clinicians have mentioned, the terror of abandonment. And that's no joke. That's pretty intense. And so you see a lot of inappropriate behaviors, extreme behaviors. When you grow up in such an unhealthy environment where you're fearful of abuse, you're fearful of sexual abuse, your self-esteem is pretty much destroyed. How you see yourself as a kid is usually through the eyes of your caretakers, and that's usually your parents. And so if you have caretakers that have really breached that honor, you see the effects of that through childhood, adolescence, and adulthood. And so when I look at some of the behaviors that Amber is showing or demonstrating or has been allegedly demonstrating, the one thing I keep in mind is, if that diagnosis is accurate, then there is a whole lot of trauma behind her terror of abandonment, as well as probably a lot of her anger and rage of not wanting to relive things she probably is triggered by in her present and probably her future. So as I said, I have a real soft spot for these folks. It is horrifically difficult and challenging, again, to keep stable relationships. There's an interesting facet to this, as many people who have a healthier view of life, a healthier reaction, deal with things healthier, usually don't tolerate somebody with the borderline behaviors for a very long time. Those are usually the folks that know something is wrong. Their friendships are too extreme. They're high maintenance individuals, smothering sometimes, kind of set friends up to fail, do a lot of testing in the way of, I'm sure you're going to leave me, and so I'm going to do some things to test you to see if you stay. And then, of course, when you leave, because you're healthier, then it's like, aha, I knew you were going to leave me. And so it makes it very difficult to have a long-term relationship with folks that have this disorder. And again, it's a personality disorder that inappropriate and unreasonable coping mechanisms are used in order to get your needs met, because that's familiar from either where they learned it as kids or saw it or reinforced that this is how you behave to get things you need. And the rest of the world doesn't really go with that. However, to me, it's always interesting that the people they get into relationships with, hence possibly Johnny, that there is a template to their dysfunction that somehow fits with somebody with these symptoms and behavioral patterns, that they get ensnared and really suffer a lot of the brunt of the behaviors, but they also come with a set of their own. And I see it very interesting that for somebody with a borderline personality disorder that truly has a fear of abandonment, and then you have somebody with a template that when things get tense or confrontational, their coping mechanism is to leave the situation, to hide from it, leave it, good, bad, or indifferent. That really triggers somebody who has that horrible fear of abandonment. And you then see some of the erratic behaviors start being demonstrated because they don't want that person to leave. Even as crazy as the situation is, there is a fear, again, that this person is leaving, they're leaving for good, and how that rips at usually the soul and the core of people with this disorder. So there, I think, is some really intense pain and fear. As confident, sometimes as cocky, as folks with this diagnosis appear to be, again, that's another one of the strategies that they've developed over time. But most of the time, if you keep scratching at that surface, you find the person who is pleading, please stay, in such an exaggerated way. I'm going to die if you leave. I'm dying. Other people may see that as an exaggeration. I see that as something that they're really feeling in their soul, and maybe one of the more honest expressions of how they really feel at a particular moment, although at an inappropriate time. People with personality disorder don't simply ask for what they need. So if they're in a relationship and the other person may be working more or have other things to do, instead of saying, I want to spend more time with you, how can we work that out? How can we do that? What you may find is someone with a personality disorder is going to demand attention by doing things to cause it, a very chaotic situation. The fights, risk of harm or threatening harm, creating a huge diversion to get the person to stay and engaged rather than simply having that conversation, because that's very unfamiliar of almost having the right to tell somebody what you need in a relationship. They probably do it in other ways of trying to backdoor what they want, and it comes off again as erratic, and usually the very thing that they want is the thing they again are reinforced they don't get from their behavior, which only makes the symptoms worse, makes the fear worse, makes the pain worse. And you really have somebody who is in horrific psychic pain. and usually not able to see what they're doing to other people. Now, what my experience of treating many, many people with this disorder is these folks are not, they're not stupid. In fact, they are usually extremely bright, extremely intelligent, sometimes very witty, very creative, not always in a good way. And they can usually read people very quickly. So they kind of know who fits in their cosmos of chaos, if you will. Healthier people that deal healthy, that are very assertive, can state their feelings, can disagree. And it doesn't mean they don't like you, it just means they disagree with something or an idea that the person with this disorder has, are usually very threatening on a lot of levels because it's unfamiliar to them. Assertive people are not game players. And so unfortunately, folks with the personality disorder have learned to play a lot of games, and I don't mean that in a negative way, but it's almost like their own game of chess, that they can change the game, change the rules, change pretty much everything to kind of comport and fit into what they're using it for to gain. And again, there's usually not a devious type of thing in many cases, not all, but in many cases, it's just their unreasonableness in their coping mechanisms that they play these games with folks to get their needs met. So when you look at some of these behaviors, and everybody has different behaviors depending on where they are in life, how they grew up, what they're surrounded with. There's a wonderful YouTuber, I think the Truth Doctor, who is a highly educated psychologist who came forward with this diagnosis publicly on YouTube, and that has demonstrated a lot of insight into her past behaviors, and to her credit, that's outstanding. That's not easy to do, because even folks who are not familiar with how this disorder has been born from trauma, there is a bad stigma associated with that, even in my profession. And like I said, I've been doing this for 40 years. I'm an OG. And there are many therapists, psychiatrists, psychologists who do not want to treat or deal with someone with that diagnosis because of the game playing, because you're going to be set up to fail perhaps. They're going to constantly test you. You may not always get the truth. It takes a long time for them to be able to understand that you're not going to leave them, but you're also not their friend. You're there to help them manage responsibly and reasonably feelings that they have, which again may sound very simple for some individuals who don't have this disorder, but for somebody who does, this is very unfamiliar territory. That's why in watching this trial, I think the most effective approach with this young woman is when the attorneys don't take a game-playing animosity position. You don't want to game playing. These folks, they're experts. They've lived that. They know how to do that. They can twist, they can turn, so that by the time it's said and done, you don't know if you're coming or going. The gaslighting, which I hate that even has a bad connotation, but it's the nomenclature that's used. But to me, I see that again as sort of, that has been their modus of operandi, and so they're very good at twisting those type of things, because it is unfamiliar to say, this is what I wanted, this is how I tried to get the attention, this is how I tried to get the love, this is how I tried to get him to stay. that's very unreasonable. And for somebody, again, in the relationship that brings their own set of issues, because this is not a one-way issue. In my opinion, I believe that a lot of the substance abuse and addiction on the other side of the relationship has really been underestimated as far as the dysfunction that brings into a relationship. If you've ever lived with an addict, an alcoholic, you know how desperately challenging that is as well. And so you have two folks who have their issues right on the surface. One that's been permitted to utilize their addiction without a lot of correction and actually has made a good living and somehow has functioned by other people, of course, permitting it, giving permission for it, codependency, etc., etc. And you have somebody on the other side of the relationship who is absolutely beautiful. Whether people can argue if they have talent or if they don't have talent, they have been now in a celebrity status and has a lot of hanger-oners as friends who have also probably taken advantage of the situation. But you've got two dysfunctional templates that when these two people got together, the template just merged. Not in a good way. In a very dysfunctional way is the reaction to one plays into the other and vice versa. And so you get these explosions of dysfunction because one person is trying to react this way and another person is interpreting in a different way, and you have a collision where probably neither of them are able to take responsibility for their part in the problems of the relationship. And that becomes kind of the perfect storm. So as we go on and we watch the end of this week of the trial and closing arguments, just please keep in mind the diagnosis. And again, I'm not diagnosing anybody, not in regard to this situation, but just keep in mind, if that's applicable, then it's born of trauma, which I think is interesting that one gentleman in the relationship was very open and honest that we know of about his trauma. And our other part in the relationship, I'm sorry, that's a train going by. And the other person in the relationship never mentioned it. And if anything, as a therapist, I can see that she really doesn't want to be looked at as somebody who's been victimized. That's, again, another strong reaction when that word was utilized, and her correction of that term is, again, I think, to the heart of she does not want to be seen as a victim, even though she is almost a self-fulfilling prophecy by the behaviors and her unreasonableness and her exaggeration of, again, being a victim of her own dysfunction on how to resolve stressors in relationships. That, unfortunately, I think this happens a whole lot more than people realize. But these two folks are in the public eye, so of course this is many of the things that that have happened in the relationship is now open for the public to give opinions on. And I think that, again, is a very difficult place to be. No surprise, he has lots of friends. He has a lot of enablers. Her enablers and friends, not so much. I think somebody had said it very well in another YouTube video, is that she had started the ball rolling on on the stories and the exaggeration and getting positives from being an ambassador, and really got on a trajectory that I don't think at some point she knew how to turn back, except ride or die, tell the story, keep it going no matter what you're faced with, no matter what is shown to you. You hold the line, as crazy and ridiculous and unreasonable as it sounds and it looks. A lot of times when push comes to shove, a person with that particular disorder will not back down. They will not back down. To apologize and admit those things, again, is so unfamiliar, because the fear of abandonment of her public now, or her fans, or her career, which I think is going to be a huge issue after the hubbub of the trial is over, of where she is, who her supporters are. And at this point in time, like I said, it's kind of a ride or die moment. And so I worry about what's to come in the future if she is not able, both of them, if they are not able to get help for their dysfunction that they have carried forward into life and relationships. That again, I think sabotage both of them. So hopefully, if you like this kind of discussion, this kind of analysis of real cases from movies, looking at diagnoses, what they represent, some of the more psychiatric symptoms, and kind of some insight. Like I said, we're not diagnosing anyone. This is not a negative look at people. That's not what this is about. Couldn't have been a therapist for this long and have that kind of an attitude. As I said, I have a very soft spot in my heart for folks who have this, because at some point many of them lose all family and friends, even therapists. The exact thing they want to is what they sabotage themselves from getting. So keep watching the child. I hope this is interesting to some folks. To me, it's always been fascinating from my life career. Like I said, just bear with me with the technical part of it. I don't even know if this thing is up on YouTube or not yet. I'm watching all the videos. So we'll see. If I don't get any views for a long time, perhaps it's never been loaded. I'm gonna learn. I'm not too old to learn. But please, I so appreciate you watching, and I appreciate people from Legal Bite. That's where I sort of got hooked onto YouTube, and I'm old. And I was like, okay, I love watching animal videos, but I really love the professional insight. And so there are many of those folks that I really, really want to thank for kind of being the inspiration for someone like me to say, okay, maybe there is an audience for this kind of conversation, again, from somebody who's been in the business for quite a while. I appreciate, friends, you coming, if anybody's coming, and I hope to make another video this week as the trial continues, and again, to see, again, I'm looking at symptoms, symptomatology, not diagnosing, but just seeing what kind of happens next. So I thank you so much for watching, and I hope to see you again soon. Bye.